Hi, everyone. Thank you for coming back to the Disinformation Chronicle. I want to talk about this new investigation I published with Real Clear Investigations. It's about Bill Gates, who you might have heard of. He's an incredibly wealthy man. Prior to current times when there's lots of billionaires, when you think of a billionaire, you think of Bill Gates. I had someone inside the NIH, a whistleblower, send me just dozens of emails, internal documents about Bill Gates' influence on the National Institutes of Health. This is the agency for the United States federal taxpayer that creates biomedical research, our policies on what we're going to study for the type of diseases we're going to look at. And the man who spends billions of dollars every year on public health was working for years to influence the American taxpayers' pot of money for biomedical research. We need to go back to understand who Bill Gates is and where this all started. Bill Gates made a ton of money through Microsoft as a monopolist. He was actually charged by the United States federal government for a monopoly. What he did is he took his money and poured it into a foundation in around 2000 with $20 billion to remake his image. And that's what he's been doing now for the last quarter of a century, spending money to remake his image. And much of his money is being poured into public health. The problem, of course, we know that what money does is money determines the direction of the type of questions you're going to ask in public health. It determines the type of policies you're going to do. It determines where we're going to put our resources, not just the money, but where we're going to put our people too. Bill Gates has been shaping this for a quarter of a century right now. You're now seeing people taking a harder look at him, looking at his impact on the World Health Organization. The World Health Organization is purportedly about the health of people in the world, but in many situations, it's about what Bill Gates wants us to study, what Bill Gates wants us to be about. This even happened during COVID, where Bill was putting his finger on the scales and determining the type of research, type of policies, and our approach to dealing with the COVID pandemic. He's getting a little bit of a pushback now, but he funds everything. Part of the reason why you don't really hear anything negative about Bill Gates is because he doesn't just pour billions of dollars, all these nonprofits that he runs. He's got a lot of them, by the way. He has so much impact now that you could end up with a public health policy, which is shaped by the Gates Foundation, then Gavi, which is a nonprofit funded and started by Bill Gates, and CEPI, which is another one also funded by Bill Gates, and the World Health Organization, and all these other nonprofits that are Bill Gates funds to create an echo chamber of Bill Gates ideas. One of the ways he helps to push this echo chamber is by funding journalism. This is from 2000, an article in the Columbia Journalism Review. The Gates Foundation had funded over $250 million going to journalism. And you can see the names. You got BBC, Al Jazeera, ProPublica, National Journal, The Guardian, Financial Times, The Atlantic, Washington Monthly, Le Monde. The one that's still going on is The Guardian, which is why you really can't trust The Guardian anymore, because they're there to be a mouthpiece for Bill Gates. Bill Gates first started pouring his money into the National Institutes of Health in 2003. Now, no group can give money directly to the National Institutes of Health, just like they can't give money directly to any agency within, United States federal government. But for places like the National Institutes of Health, for the CDC, corporations and special interests can bring in funding by sending it to a foundation. In the case of the National Institutes of Health, it's called the Foundation for the National Institutes of Health, which was set up in 1990 to serve as a sort of firewall between these outside interests and NIH researchers. So in 2003, Gates gave $200 million to the NIH, to the foundation to the NIH, which then went to the NIH, purportedly to serving as a firewall. We kind of know that wasn't true. In 2008, there was actually an article published by a couple of researchers at Rice University. They warned that this $200 million, first off, is an unprecedented sum to be given to the National Institutes of Health. These Rice researchers warned that this was going to be shifting the priorities of the NIH, even though the money is being cycled through the foundation to the NIH. What they said was the foundation for the NIH manages this money. They take the money in, but the Gates Foundation Scientific Board, they oversee and select the projects to be funded at the NIH. So the money goes to the foundation, but Gates gets to come in and say, okay, well, here's what we want it to go to. So what has this resulted in? In 2013, Bill Gates gave an inaugural address at the NIH. And at that point in time, they've started to synchronize their research policies, their funding, and some of the clinical trials they were running. They started to have these annual workshops together between the Gates Foundation and NIH. The NIH would always give them first billing. These were meetings that were happening on federal property, and yet they rebranded as the Bill and Melinda Gates Foundation NIH Consultative Workshop. This was in the 2015 workshop. This was also in the 2016 workshop and in a 2017 workshop. Each time when they're coming together, the Gates Foundation is being given first billing. When you start looking through the documents that I was given, how they're starting to combine their research programs, what I called synchronizing. By 2016, the Gates Foundation it's firmly entwined with an NIH ecosystem. They're now having dual workshops, joint clinical trials, combined research policies, and these collaborative funding efforts. Sometimes it was like, hey, if the NIH can't fund someone, why don't we send them over to the Gates? Or if Gates can't fund them, how can we make it so that our money is basically one big pot of money? Well, the problem with that, of course, is that the money from the NIH, it belongs to us. It doesn't belong to Bill Gates. It belongs to us. It's our money. In some examples, you can see that the NIH staff and Gates employees work together on clinical trials for TB treatment in Africa. And both the Gates and the NIH employees began a joint study for TB. This was with the support from the Chinese Ministry of Science and Technology. So they're also working with all these other global groups. Sometimes, believe it or not, some of these groups out there, they don't have the best interests of Americans at heart. 2016 was pretty important. It was the third Gates NIH annual meeting. And it was so important because Bill Gates was coming. The night before the meeting, the NIH held a reception and a catered dinner paid for by the Foundation of National Institutes of Health, with almost 24 Gates executives at the Cloisters Mansion. The Cloisters Mansion, it's a stone castle. It's famous and quite well known in the area because this is where actor Will Smith married actress Jada Pinkett. The NIH was continuing to scramble that night to lock down the arrival of other people, including top Obama officials at the Department of Health and Human Services and the Commissioner of the Food and Drug Administration, Robert Califf. I've written about him before. Mr. Califf always likes to be very close to industry. To ensure that Gates had this luxurious experience when he came to the NIH, staff gave to Director Francis Collins, who, by the way, was a Nobel Prize winner, a minute-by-minute itinerary to ensure that every moment that Gates was there was going to be the best moment. At 8:20, they have him arriving at the gate. They had the NIH police waiting at the entrance, waiting for Bill Gates, and then escorting his 3-vehicle convoy the final half mile to the building where they were having the conference. Guess who's lingering there waiting for him? Dr. Francis Collins, the director of the NIH. A lady in waiting. Dr. Collins will meet Bill Gates after he exits the car and steps inside the building. Bill Gates is escorted by Dr. Collins to the main auditorium. Bill Gates and Dr. Collins has reserved seats at the front table, angled chevron style. Every moment was designed to ensure Bill Gates, who by 2016 had given almost $430 million to the NIH. One of the panels, the moderator was Tony Fauci, who was director at the time of the NIAID. This is the guy who was put in charge of all the COVID response. One of the topics for discussion, it says right here, industrial incentives to develop pandemic preventive vaccines and requirements for effective collaboration. What they're talking about is public-private partnerships to develop vaccines for a pandemic. That's exactly what happened when COVID hit. That was Operation Warp Speed. What was so interesting about this piece is that no one wanted to talk to me. I sent multiple emails to people who'd criticized Gates in the past, to people who had criticized the National Institutes of Health. No one wanted to respond. There was one document I was given that helped me understand why no one wanted to criticize this relationship between Gates and the National Institutes of Health. This is a document that's coming from one of the senior NIH official, and he's discussing the entire relationship as it began in 2013. He says, it's a natural partnership since the two organizations represent 57% of global health research and development. And that's why no one wanted to talk to me and complain about this, because if you complain about the NIH or the Gates Foundation, where are you going to get money from to do public health research? Where else is there to go? They've got over half of all the money across the planet is coming from this combined pot of money from Gates and the National Institutes of Health. Gates gets this royal treatment. The way that he was brought into the NIH with police escort, the director waiting there, what I was told from a senior official at HHS is that the only people who get that when they arrive on the NIH is the President of the United States, the First Lady, and visiting dignitaries of state. I think that Bill Gates is the only private individual who's ever been treated this way in the history of the National Institutes of Health. But after he has this meeting, the Foundation for the National Institutes of Health gives Gates this award because he's given over $430 million. What's interesting is who also was given an award, because it tells you a little about who Gates is. The other person was Pfizer, the vaccine manufacturer. They had given only $73 million. But it gives you a sense of the crowd that Gates runs in. It's mostly the vaccine manufacturers. So let's talk about this Foundation for the National Institutes of Health. Again, it was set up in 1990 to serve as a firewall for outsiders, and they're given money to ensure they weren't influencing research. We know it's not true. I actually wrote about this in 2018 for the Washington Post. NIH officials were funded by beer and liquor companies through the Foundation for the National Institutes of Health. It was discovered that they were in frequent contact with the alcohol industry while designing a study that seemed predetermined to find alcohol's benefits but no potential harm, such as, well, guess what a harm is? We all know this, cancer. Even though the money goes through the foundation, basically there's still all this communication happening between these outside interests and the NIH people who are getting the money on the other end. It also came to a head that same year because the drug makers were trying to give $400 million to the National Institutes of Health to investigate opioid alternatives and addiction treatments. But the director stepped in and said, actually, no, we can't do that. This was at the height of the opioid epidemic and probably would have been fired if you had taken all this money when so many people were dying at the time. There's still money coming in from the Foundation of the National Institutes of Health. This is a group that's always maintained very close ties to industry. The current CEO who came in 2021 is Julie Gerberding. And guess where she was before she came over to run the Foundation for the National Institutes of Health? She was president of Merck vaccines. So we know where most of the money is coming in and where most of the interests are coming in. It's from the vaccine and the pharmaceutical industry, which is essentially also Bill Gates when you look at his history of what he funds. I have more stuff coming on this. This is just the first story. There's more stuff in the documents. Please keep following. If you can, please subscribe at this time, and I'll be back with some more stories. Thanks so much, guys, and please keep coming back.